So the next aspect is to facilitate a rehabilitation team, and hopefully they all work collaboratively. That's the aim. So your vet's going to be there for your diagnosis, your progress monitoring, and the understanding of the underlying pathophysiology of the problem. Hoof care practitioner, so I generally want to take shoes off horses when they're rehabbing for most injuries, because especially if they're being locked up for a period of time, I want to promote circulation through the limbs and through the body. I also want to be able to adjust balance at much smaller intervals. So generally we'll take it back to 4 weeks so that we can really help the body maintain a better posture. The only time that becomes difficult is when you've got, problems with weight bearing due to the injury, such as, fractured pelvis. It can be quite a challenge then to trim a horse's feet when they're in that much pain. Your body workers are super important, and often the body worker is the person who is, in my position anyway, obviously I'm a vet as well, but often the person who's kind of overseeing and supporting the client the most, because I'm there involved in it the most, and kind of being the in-between person. Hopefully in the future we'll have rehab technicians that can help you with the specifics of the exercises and make sure that they're all being done correctly. Saddlefitter is going to be important, especially if you've done now a lot of groundwork and in-hand work as part of the rehab program. You may have completely changed the posture and the shape of your horse, and so you may need to get the saddle fitted. But when you've had a period of time out of the saddle anyway, that's going to be important. And some rehab plans involve riding, so you'll want to get it checked in the progress of your rehab plan. And then a nutritionist or a herbalist may be involved as well to aid with the healing. For example, vitamin E is really beneficial for nerve damage, and we might need it for some extra pain relief. You also might need to look after the gut if they're being locked up, and you have to consider nutritionally what they're being fed with their altered calorie requirements, because if they're being locked up, you need to maintain those calorie requirements. You need to feed them at a minimum of 4 to 6 hours, but it's going to be different to their normal workload and normally being out in the paddock. So the owner is probably a major factor, because it requires your time and commitment. You can build on your skills and the money, that really depends. You can still establish a really great rehab program without a whole lot of money, but the time and the commitment and the psychological strain can be challenging. So the horse is also an important player. The age and the sex, so how old they are, is going to determine their healing capacity, but it will also determine, how much handling and training they've had, and the prognosis of the injury. The handling and training. So, some horses are mostly ridden and haven't had much in-hand work. And for a lot of rehab programs, the groundwork and the in-hand work is a foundational aspect of that. So there may be difficulties and challenges there with handling. And it also, could be their age or their sex. It could have a stallion that hasn't done much. Their pain threshold. So some horses do have an amazing pain threshold. As I said, they are prey animals, but then other horses, not so much. And so you have to adapt to that and figure out how much pain relief they need without creating a problem with them running around and doing too much. Their behavior. So some horses can be really bitey on the ground, and they can be really expressive in their behavior. And so we're going to have to be able to deal with that. Their posture. So do we need to improve their overall posture? Was that an inciting problem? Or do we have now postural problems due to offloading certain areas? And we're going to have to kind of deal with that posture. You can't always deal with it as you're going if there's too much pain. So you've got to kind of manage it how you can with your body work and pain relief to try to optimize that posture as it can lead to, as I said, compensatory mechanisms and patterns that the body recognizes as normal. Hoof balance, we've talked about that. Fitness. So having a super fit horse come into a rehab program has its pros and cons. You can avoid as much muscle loss, but if they're super fit and you now have to lock them up, then they can be very difficult to handle with controlled motion. And so you often will have to adapt to the fitness of the horse. Any previous trauma? So is there other previous trauma where they're struggling with the weight-bearing aspect of the injury? I looked at a horse years ago who had done a suspensory branch and it just wasn't healing very well. And as you know, part of the assessment, I don't remember exactly how it came up, but I think I said, oh, his pelvis looks really asymmetrical. She said, oh yeah, like he's had a fractured pelvis. Oh, okay, well, it was on the opposite side to the suspensory. And so likely that's why the suspensory has occurred. So rehabbing the suspensory is not going to be the answer. We have to fix his posture and his hoof balance. And that's going to be, you know, an important part of the program. The social situation. So obviously horses are social animals, and if you have to lock them up for a period of time, we want them to stay as calm and relaxed as possible to help with their healing and to avoid other injuries. So you might have to get a friend. You might have to set the yard up in a different area so that they can see horses. You might have to get a goat or a sheep or a pony to keep them company, and obviously one that they like. Otherwise, that could also not be too good. So there's a lot of horse factors that we have to consider as well, and you will know your horse the best. So with your bodyworker and vet working out the rehab program, you'll be able to tailor it to yourself and the horse factors, and also the environmental factors.